Alright, so let's talk kidney stones. Also known as nephrolithiasis, kidney stones can cause a significant amount of pain and disruption to your life. So what are the symptoms? Some of the symptoms can include back, side, or abdominal pain that can come and go, blood in the urine, nausea, vomiting, testicular or groin pain, and sometimes even urinary urgency. Let's see how kidney stones form.
Each person has 2 kidneys. Your kidneys make urine by removing water, waste, sugar, and many other kinds of substances from your blood. The urine moves from your kidneys to your bladder through 2 tubes called the ureters. Your bladder stores the urine until it leaves your body through another tube called the urethra. Your urine can contain many kinds of chemicals. These include calcium, oxalate, and phosphate. Sometimes one or more of these chemicals can clump together and form crystals. A small stone may pass out of the body without being noticed. But a larger stone may stay in your kidney or become stuck in a ureter, the bladder, or the urethra.
So how do we diagnose kidney stones? We usually run a urine test to see if there's any blood or urine infection. Also, we use various imaging studies to find the size and location of your kidney stone. These can include a renal ultrasound, which is non-invasive, has no radiation, and can be done in the office. It can also be a CT scan, which has the most radiation, but is the best test for kidney stones. Or we can obtain an abdominal X-ray for large stones in the kidney. Treatment of your kidney stone depends on the size and location of your stone. There are 5 main types of treatment for kidney stones. Number 1, there's observation, or known as medical expulsive therapy. This includes the use of Flomax, which is a medication that helps to relax the ureter, and monitoring for any signs of swelling or hydronephrosis of your kidney with a renal ultrasound in 2 weeks. Another option is extracorporeal shockwave lithotripsy, better known as lithotripsy or ESWL, ESWL. This involves general anesthesia and is usually done at our outpatient surgical center and involves sending sound waves through your skin to break the stone into many pieces that you then will urinate out. Another treatment option involves a cystoscopy, which is a camera placed inside the tube that you pee from, called your urethra, to enter into the bladder, and we place a small piece of plastic called a ureteral stent from the kidney down to the bladder. This allows the kidney to drain as it has been blocked with urine due to the kidney stone. This does not treat the kidney stone, but allows that kidney to become unblocked and allows for subsequent procedures that will definitively treat the kidney stone. Another treatment option is ureteroscopy with laser lithotripsy. This again involves a cystoscopy, which is a camera placed through the tube that you pee from, the urethra, until entry is gained into your bladder. No cuts are made on your skin. We then send a smaller camera up the ureter to the level of the kidney stone, and we're able to use a laser to break that stone into many pieces and pull those pieces out. After this procedure, you will also get a ureteral stent, the piece of plastic that drains the kidney, which helps to prevent any further swelling to that kidney. The stent will remain in place for about 3 to 5 days after your procedure and then can be removed. The last treatment option is called a percutaneous nephrolithotomy, also known as PCNL. This is the most invasive procedure that we perform for kidney stones, and usually is done for large kidney stones within the kidney. This involves placement of a nephrostomy tube in the back by our interventional radiologist, and later that day we proceed to the operating room where we make a small incision on your back to be able to send cameras into the kidney. This allows us direct access to these large kidney stones where we can use larger instruments to break them up and pull them out. After the procedure, you will have a nephrostomy tube, which is a tube from your kidney coming out of your skin, draining your urine, and you will stay in the hospital overnight. If everything looks well in the morning, we will plan to remove the nephrostomy tube and send you home later that day without any tubes and hopefully without any kidney stones.